A lot of the common questions that patients ask once they've had a transplant are, is my organ working, and how long is it going to work for, and how will I know if I'm in trouble? I'm Kathy Cable and I'm the nurse practitioner here at the transplant unit at Westmead. Part of my role is a little bit nursing, a little bit medical, and predominantly the human polyfiller of the unit once the patients have their transplant. Patients waking up after a transplant often are a little bit out of it anyway because they've had an anaesthetic, but they also have trouble remembering what we went through before the operation. The most common question is my organ working, and obviously if you've had a heart, a liver or a lung, if you're asking the question, then it's working. With a kidney and pancreas, it's not so obvious. So you need to tell them that, they're passing urine, so that's working, or their pancreas has good function and their blood sugars have normalised, so that's working. But it's not as obvious to them laying in the bed. We have two definitions of death in Australia, one of them being brain death, the other one being circulatory death. So if you receive a kidney from a deceased after circulatory death donation, then you may have a kidney that didn't have adequate blood supply and oxygen for a little while, and so it goes into acute kidney injury. And it doesn't mean that it's a substandard organ for you. It still can be a beautiful kidney and a beautiful gift from the family that donated, but it just means it's gone to sleep a little bit, and your team will inform you of that. The majority of our patients stay in hospital. From a kidney and a kidney pancreas point of view, the length of stay is usually between 7 and 10 days. However, for a liver, heart and lung, they're a lot different in terms of you're tied to the in-centre because you often go back to the intensive care unit. The important thing is when you have your transplant that you have a support person there, because when we discharge patients at day 7, you're fit enough to go away from the hospital, but you're not going to be fit enough to do things like, make a meal for yourself, do your washing, and sometimes even walk up independently to come to the transplant clinic. Once you are discharged from hospital, most transplant units have a transplant clinic for you to come and be reviewed in. And if that graft function goes off, then we've got you there, and that difference can be overnight. So that's why we monitor you quite closely. And we find that if you treat complications quickly, then you don't get scarring in your organ. So we put the effort into the early post-transplant phase, and then we gradually wean you off us. We cut the umbilical cord and let you out into the community and let you take care of yourself. The most common side effects of transplant that we see are often rejection, because your immune system is primed to tell you that you've got something foreign and wants to get rid of it. And all it means is that if you do have rejection, we then have to increase your immunosuppression. The other side effect that we see a lot of is wound breakdown, and that can be really disappointing. So if that happens, that can delay your progress to being discharged. Some of the normal activities that transplant recipients want to get back to are things like driving. And so we say, talk to your insurance company and find out, but the majority of you should be allowed to drive within 4 to 6 weeks of you having the surgery. What we recommend in terms of sexual activity for our patients post-transplant is, if it feels okay and safe and doesn't cause pain, then it's okay. You need to think about contraception, because pregnancy isn't an option for the first 12 to 18 months after a transplant because of the medications you're on. You also may be wondering when it's safe to come back to work, and a lot of that depends on how physical your work is. So it's going to be an individual conversation with each of our patients to see when they can return to work. In terms of can you go out to the shops or can you go to the movies, this of course has changed a little bit during COVID, but what we were saying is that if you can stay a cough away from people, and that's going to, with social distancing, that should be easy for you now. You don't pick peak times to go to the shops, but the whole process of having a transplant is trying to get you back to normal as much as possible.